Okay. All right, everybody. Hi, this is Representative Dan Miller. Glad to see everybody here today this afternoon. You are joining us for the first of our August Lunch and Learn series. Now, these are meant to be informal, sort of casual over lunch. So hopefully for those of you who are joining us live, you get a chance to eat some food and maybe learn a couple things together regarding Medicaid and SNAP in particular, but these federal changes that have come across. And I want to just say a couple words regarding the format here too. Again, this is casual, and I have reached out to a couple people who are experts in this field. They've been helping, serving, knowing the law, understanding issues for a long time in this regard. I reached out to them with the idea of saying, like, look, we need to find a way to bring information to people in biteable formats that can help sort of elevate people's understanding about what's been discussed, how the programs currently work, how they may be working, and how people should be maybe cognizant of where pitfalls may lie ahead. You're going to hear us talk about what we know so far. You're going to hear us reference things like we're going to have to wait and see a little bit. Those are true. Those are true statements that you're going to hear a little bit about. The key thing about it is that we were inundated. For those of you who don't know, my office during my time in the legislature has prioritized disability and mental health work in particular. And we were inundated by people asking us about Medicaid in particular and the changes that come up. So while we hope to keep this casual, hopefully a degree of entertaining and a degree of informal, I do want to note that these are life-sustaining programs. These are programs that, to be honest with you, really, one can argue, especially on the Medicaid front, they weren't fulfilling some of their promises before the federal changes that were recently enacted. And I'm very concerned. Medicaid in particular is a program that so many in the disability arena, and I say just for the political purposes, Democrat, Republican, Independent alike, you're the same group of people who've come to my Disability and Mental Health Summit. You're the same group of people who've come up there and we've shared stories of family issues, things that we've had to, that we maybe share in common. Those challenges are things that when, well, you just can appreciate when we share things in common, say it that way, especially in today's times when so many other things want to divide us and splinter us. Medicaid is one of those programs, along with SNAP, that has been available for everybody. It doesn't matter your party affiliation. There's a need there. And today's discussion, we're going to be talking about why Medicaid and SNAP were created in particular. We're trying to give you a little bit of the background, sort of legislative intent behind the creation of these programs, what they were designed to do, why they were designed to do it, how people access them. This is the first of what I believe, if I got it straight, 6, unless I make up more before the end of the month, 6 discussions that we're going to have over lunch. Okay, so we're going to try and cram a bunch in. I'm going to try and minimize as much as possible, maybe hearing from me. And instead, we're going to rely on people who know more about these programs. And I'm very thankful to have 2 of them with me here for today's lunch. So let me introduce them, and then we're going to get right into the topics. So first is Aaron Gay. Aaron is the co-director of the Pennsylvania Health Law Project, the statewide nonprofit legal aid organization. The Pennsylvania Health Law Project has been helping Pennsylvanians navigate the Medicaid program and understand and exercise their legal rights for more than 30 years. So obviously, the expertise is there. 30 years of helping Pennsylvanians in particular. Very much appreciate having Aaron here with us today. Is Sarah Reed. Sarah Reed is a licensed social worker and a SNAP specialist at Just Harvest. A single mom, Sarah once relied on programs like SNAP, like I did, Sarah. So I appreciate you mentioning that too. But that's how we grew up with on benefits like that. Medical assistance and WIC to support her family. She believes that maintaining access to SNAP and Medicaid is critical for public health and wellness. Just Harvest, like the Pennsylvania Health Law Project, has a long history of helping people in our state. They have periodically been of assistance in programs that my office has done. We're very honored to have both of their organizations here with us today to give us a bit of a snapshot behind the curtain as to these 2 important programs, Medicaid and SNAP. And with that, we're going to be going over to Aaron to kick us off. Aaron, please take it away.
All right, thanks, Representative Miller. Nice to be with everybody today to talk about the Medicaid program. I'm going to give a quick overview, run through a lot of information, and want to leave plenty of time for Sarah to talk about the SNAP program. So next slide, Louise. So Medicaid was signed into law in 1965. We just celebrated the 60th anniversary. It was enacted July 30th of 1965. It was created as a public health insurance program for certain people who otherwise couldn't afford it. So when it first started, it was tied primarily to groups of people who were getting cash welfare benefits, mothers and very young children, some older adults, and some people with disabilities. And it was created as a federal-state partnership. It still is today. And the federal government sets out broad rules about who needs to be covered, what services need to be covered, and they provide some funding for it. And then states administer it. So every state's Medicaid program is different. We're just going to talk about Pennsylvania's program today. And then the states can tailor their programs to meet the needs of their residents. So they have to stay within the broad federal rules, but they have a lot of flexibility to design their program. And then the states also fund this program. So Pennsylvania started our Medicaid program in 1967. It's called medical assistance. So if you see that term, that is Pennsylvania's Medicaid program. And then in the 70s and 80s, it expanded to cover different people. So it kind of was less tied to people getting cash assistance. It expanded to uncover pregnant women with limited incomes, children up to the age of 18 and families with limited incomes, older adults and people with disabilities who weren't necessarily getting cash benefits, but who still had very low income and very little resources and who weren't able to purchase coverage otherwise. And then in the early 80s, it established an option for states to request waivers to provide home and community-based services to certain groups of people with disabilities and older adults to give folks an alternative to institutional care. So this is for people that needed supports and services, medical and non-medical, to remain living amongst their family and friends in their homes and communities and not have to be served in institutions. Then in 2010, the Affordable Care Act was passed. This created a new group of people that could be covered by Medicaid, and the new group was low-income adults. This became a federal option in 2014. Pennsylvania chose to cover this population in 2015. So prior to this expansion to the low-income adults, it didn't matter if you had no income. It didn't matter if you were sick and needed health care. If you didn't have children, if you weren't an older adult or a person with a disability, you couldn't get Medicaid. So that changed with Medicaid expansion. Okay, next slide. So today, Pennsylvania covers 3 million people in Pennsylvania. So that's nearly 1 in 4. Nearly 25% of Pennsylvanians rely on Medicaid. So chances are you listening today or someone that you care about has Medicaid. It covers nearly 40% of kids in Pennsylvania. It covers nearly 50% of kids with disabilities or special health care needs, because Medicaid covers services that commercial insurances don't cover, or that commercial insurances place caps on, including home health services, certain therapies, certain medical equipment, skilled nursing. It covers 1 in 3 births in Pennsylvania. It covers almost 60% of nursing home residents. It covers home and community-based services for more than 190,000 people with disabilities and older adults so that they can stay living in their homes and communities. And then the expansion population represents 21% of Pennsylvanians. This is the 19 to 64-year-olds with limited income. So this is a single person making less than $21,500 a year that benefited from Medicaid expansion. Next slide. So again, over time, the services changed and expanded. Initially, it provided basic medical care. Today, it covers a broad range of services: mental health and substance use treatment, pregnancy and postpartum services, prescription drugs, dental care, school-based services, services in the home, services in institutions. So it's a really big, important program. It's the biggest source of funding for behavioral health services. And it's the single largest payer for long-term care services and supports, again, in the community as well as nursing homes. So it's a big program. It's important for the people that rely on it for their health, well-being, and independence. And it's a really important part of our overall healthcare system. Next slide. Another way Medicaid has changed over time is that a lot of people in Pennsylvania have their Medicaid through a managed care plan. So 90% of people who get Medicaid today here in Pennsylvania are covered by managed care. So the access cards, that's kind of the fee for service, the original delivery system. Health Choices is a managed care plan that started in the late 90s, and Community Health Choices started in 2018 here in southwestern Pennsylvania. So these are the insurance companies that provide Medicaid coverage to people in Pennsylvania. These companies specifically cover folks here in southwestern Pennsylvania. So a lot of people we talk to don't even necessarily realize that they have Medicaid. They have an insurance card, and nowhere on that card does it say Medicaid or medical assistance. So just wanted to note that shift to managed care for most Medicaid coverage today. Next slide. And then just to get back to how Medicaid is funded in Pennsylvania, again, it's a federal-state partnership. So financing is shared between both the federal government and the state government. And the federal government establishes a federal medical assistance percentage that is a formula based on kind of the average income of people living in that state compared to the average income across the country. So poorer states get a bigger federal match or a bigger FMAP payment than states that are considered wealthier or that have higher incomes. So right now in Pennsylvania, our standard federal match or FMAP payment is 55%. 55% of Pennsylvania's Medicaid program is covered by the federal government, with the state coming up with the remaining 45%. Now, this is a little more nuanced. Like a lot of the Medicaid program, there's lots of nuances. So the nuance is that with the Medicaid expansion population, to encourage states to cover this group of people, the adults with low incomes, they incentivized the states and gave an enhanced match. So the federal government actually pays for 90% of the funding for that population. So in actuality, when we consider the enhanced match and the standard federal match, the reality is that the federal government's paying more than 55% of our Medicaid program. I think it comes out to 64% between those two matching rates. So we're heavily reliant on federal funding for our Medicaid program, like every state is, to be honest. Okay, next slide. Okay, and as Representative Miller mentioned, there's big changes coming for Medicaid, and this is all happening because last month a new federal budget law was passed that includes significant and historic cuts to the Medicaid program. So how this is all going to play out, a lot of decisions still need to be made, a lot of guidance needs to be issued. So Pennsylvania does still need to make decisions about how things are going to be implemented over the next couple years here in Pennsylvania. But just some things to look out for, and I know that these are going to be topics of future Lunch and Learn sessions over the upcoming weeks. But there's going to be new work reporting requirements for the Medicaid expansion group. And again, this group covers gig workers, direct care workers, people that are students, people that can't work because they're caring for kids or other family members. So people are going to have to show that they either are working and meeting that requirement or why they're exempt. And then this group is also going to have more frequent eligibility redetermination. So instead of having to prove that they're still eligible once a year, this expansion group is going to have to do that twice a year. And this just means more paperwork, more burden on individuals to kind of sort through all of this, get the paperwork completed and submitted, and more burden on the Medicaid offices, those caseworkers at the county assistance office, to process a lot more paperwork. And so the concern is that even though these changes are targeted to the Medicaid expansion group, that there will likely be spillover effect. People struggle right now with paperwork getting delayed or lost, or not getting the paperwork in time to fill it out and get it back in before the deadline. So people have a problem. There's a big problem in Medicaid with churn, where people lose coverage and then go back on it once they sort out all the paperwork problems. Another big change that's happening is that there are changes to how states draw down federal funds that will mean that there's less federal funding coming into Pennsylvania, creating budget holes that we really have no way to fill in unless there's increased revenues, possible increased taxes. These are all decisions that the legislature has to make working with the governor. So big decisions ahead, how to make up for loss of federal funds resulting from this federal budget bill. Next slide. Okay, so the big takeaways right now are the Medicaid changes will take effect over several years. Nothing is changing today. So people can still apply for Medicaid the same way that they have been able to. These changes don't start until the end of next year, beginning of 2027. So if you or someone you care about is on Medicaid right now, make sure your address is up to date with the county assistance office or Encompass. If you move, make sure to report your change of address quickly. This will ensure that you get all the important notices coming in future years about changes so that you know what to do. And it's really important when you get mail from the county assistance office or from the Department of Human Services, you open it and read your Compass messages so that you can stay on top of mail that needs to be attended to. If you need somebody to help you, if you want to have somebody get copies of your notices, you can request that. Just put it in writing to the county assistance office, say that you want a representative to be added to your case, or you want somebody to get copies of your notices, and they can do that. And then stay engaged. So stay in touch with Representative Miller's office. You can follow the Pennsylvania Health Law Project, join our newsletter. The Pennsylvania Health Access Network is going to be talking to you all in future sessions. Just stay connected to groups who can provide updates as these Medicaid changes are implemented and as developments happen. Next slide just shows how to get in touch with us at the Pennsylvania Health Law Project if you're interested. So thank you very much. That was a quick overview of Pennsylvania's Medicaid program.
Yeah, thank you. And there's so much there for information. I want to be sure people know as well that every one of these lunch and learns we're going to be doing will be available as well on our website. So give us a little bit. They'll all be up there, and you'll have the slide information because, to be honest, some of the numbers, again, are staggering. And that was part of the point here, was to hit people, give you the sort of nuts and bolts as to how massively important Medicaid is. And speaking of something important, let's go to Sarah as we tick through our 30-minute lunch and learn. Sarah, please jump on in.
Absolutely. All right. Well, thank you for having me, Representative Miller, and for having Just Harvest here. Today, I'm going to just go over the basic, an overview of SNAP benefits and some introductions, touching on history of SNAP, who SNAP serves, why it's important, and some upcoming changes that we've all been hearing about. Okay, so next slide, please. All right, so with the history of SNAP, the Supplemental Nutrition Assistance Program, best known as food stamps, but it's SNAP. It's existed in some form since the 1930s. SNAP is the most critical program in the United States to address food insecurity. So we've had SNAP in some form since the 1930s, with some pilot programs throughout the early 60s, which brings us to 1964 when Congress passed the Food Stamp Act of 64. So that made the program permanent. And the intention behind this was to strengthen agricultural economies in rural areas, and as well to provide improved nutrition to low-income households. Then more recently, the purpose of connecting people to work was added legislatively in 2023, and that is just a requirement now to participate in the program. Another major change to SNAP was how the benefit was actually distributed. So the first benefits were paper coupons, and then starting in the early 2000s, those were phased out and replaced with the EBT card, or electronic benefit transfer. So these cards work very much like a debit card, where you just swipe them at the checkout machine. And in 2008, the program was finally named SNAP. Next slide. All right, so here is just a visual representation of those old food coupons, food stamps, where folks would redeem them at grocery stores or, corner markets. And then the bottom right-hand corner is the current version of the Pennsylvania EBT card. Next slide. So why SNAP matters? SNAP supports Pennsylvania. SNAP is the most important anti-hunger program in the U.S. It helps families to afford adequate and appropriate foods. It also offers family choice in what they buy. SNAP is found to increase lifetime earnings and decrease long-term healthcare costs. So we know that it reduces hunger, it improves dietary intake, and then we see longer term lasting benefits such as higher wage earning potential, lower Medicaid costs, and also improved educational outcomes for children. And there are many other researched benefits that SNAP provides to folks as well. SNAP is also an economic driver. The USDA estimates that every dollar of SNAP generates $1.54 in economic activity. So we know that it supports more than 100,000 food retailers in Pennsylvania. And that also includes 200 farmers markets and farm stands. So it gives people options of where they can spend their SNAP dollars. SNAP is also designed to respond to disasters and economic downturns. So this is very critical, especially during recession eras. We know that budgets become more restrictive. And also more recently, in terms of disasters, I'm sure many of us remember the major power outage that we all experienced earlier in the spring. So there was an authorization to replace an emergency benefit for that month, where people were able to get those benefits replaced due to that disaster. Finally, it also reaches those that are in need and reduces poverty. So we estimate that 70% of Pennsylvania SNAP recipients do live in households with incomes, 70% of them below the federal poverty line. And SNAP has lifted over 100,000 children out of poverty. These numbers are from 2015 to 2019. Next slide. So who receives SNAP in Pennsylvania? Nearly 2 million people. So that's 1 in 7 people who rely on SNAP. And, just as Aaron said earlier about 1 in 4 on Medicaid, I'm sure with 1 in 7, this could be somebody you know, a family member, a loved one, or friend. And then some of the breakdowns of families and individuals who receive SNAP. So 58% do include a child, 44% include an older adult, 53% include someone with a disability. And I think this is a really important statistic to share out, that 40% of folks who receive SNAP do work. They're working families. Many times they're working full time. And you simply just don't earn enough to make ends meet and keep up with all those expenses. Okay, next slide. All right, I'm going to just do a brief overview to some of the recent federal changes that will be happening to SNAP. Next slide. So one of the first key changes has to do with work reporting. So up until now, most counties in Pennsylvania were under a waiver that suspended the work requirement. We know now that that will most likely end August 31st of this month of 2025. So unless people are eligible for specific exemptions, many adults will be subject to work reporting requirements and a time limit to receive SNAP if they don't meet a requirement or have an exemption. So we are now looking at a change where there's going to be a restriction of waivers of that work requirement to areas with an unemployment rate of over 10%. So previously, areas with higher than average unemployment rates could be exempt. And then additionally, this is going to expand the work requirement and 3-month time limit to include some new groups that were not necessarily included before. So that's adults with children age 14 and older, older adults now 55 to 64, veterans, and young people who recently aged out of foster care. The federal government also eliminated exemptions for individuals who are homeless. However, we're really thrilled to find out that Pennsylvania will be using its waiver ability to now exempt homeless people from having that requirement. All right, my apologies. And then we do estimate, DHS estimates that roughly 144,000 adults are at risk of losing their benefits. So I do want to emphasize that as effective as of September 1st, 2025 is when that current geographic work waiver will be expiring. Okay, next slide. All right, there will be some key changes in benefits. So the first that's change that is occurring effective October 2025, there's going to be a narrow option to count various utility costs. So right now we have a simplification process of counting heating costs for households that get LIHEAP, except for households with older adults or disabled members. So now that pretty much means that everyone will have to physically verify their heating expenses. We know that this is just going to increase paperwork for nearly 300,000 Pennsylvania families, in addition to causing, greater burden to county assistance offices. Another group that we feel could be harmed by this change would be those who rent that have their heat included. They now may see a decrease in their SNAP benefit. Effective before November 2025, thousands of lawful immigrants will no longer qualify for SNAP. So right now there are so many groups of lawfully present immigrants that are able to receive SNAP benefits. So that would be refugees, asylees, and trafficking victims. They're no longer going to qualify. That will lead to 30,000 lawfully present folks, immigrants, resulting in a loss of about $55 million per year in federal food benefits. And then effective as of October 2026, there will be a restriction to future updates to benefit amounts. So when updating benefits now, the only changes will be allowing for inflation costs, not to dietary guidelines or food usage. It's anticipated that this will be a $35 billion cut from 2027 to 2034. So that equates to roughly 1 day's worth of groceries per person a month. Now we are waiting for, final wording from DHS when exactly some of these will go into effect. Next slide, please. And now key changes to funding for SNAP. So right now there is a cost sharing, administrative cost sharing between the federal government and the state. So currently that is a 50-50. And now, effective as of October 2026, it will have the federal share of SNAP administrative costs from 50 now to only 25%. So that means Pennsylvania will be responsible for coming up with 75% of SNAP admin costs, which may add around $130 million per year in costs to the state. The other portion of funding change is now there will be a new state SNAP benefit cost requirement. All right, so to keep the SNAP program, there's going to be cost sharing. That cost sharing is going to be based on error rates. Now, error rates are not necessarily due to fraud. It is errors either by underreporting, overreporting, or caseworkers missing required deadlines. Okay, next slide. All right, and then of course, the key takeaways from all of this is, again, please make sure if you do receive SNAP that you change if you have an address to change, please change it with the county assistance office or COMPAS. Please make sure they have current address and phone number. And there will be mailings coming out shortly to any adult who may be subject to that time limit to see if they qualify for any exemptions or whatnot. And that's all that I have. Thank you.
Thank you, Sarah. Okay, so obviously there's a lot of information. So let me give you a couple of things, and then I want to ask one real quick. So I know we're going to be a couple minutes over, but look, there's a lot of information here. And here's the good news is we're going to break it down a little bit further on a variety of topics. So hang tight. We're going to give you the dates for each one that's coming up, and then you can pick one to get more information that's coming your way. So that's a good thing. We know there's a lot of information being thrown at you at one time. I did want to just kind of ask for both Aaron and Sarah, just real quick. Aaron and Sarah, same question if you can here, but tell me here in a quick summation, what was the world like before Medicaid for the population who benefits from it? So Aaron will get to Medicaid, and Sarah, I'll ask you the same thing for SNAP. Aaron, what was the world
Yep.
like before Medicaid for people who were benefiting from the program today?
Yep, sure. Before Medicaid, people had to rely on doctors donating their services to see them. They had to rely on charity care for hospitals. So a lot of them went without care, or they just were at the mercy of getting some charity from providers and hospital systems.
Sarah, give us that idea here before SNAP or efforts like SNAP.
Sure. So, that was quite some time ago, but it would have meant that people simply went hungry. Oftentimes, adults or parents will not eat so their kids can eat. That means stretching food in ways that may not be appropriate. And, it just means more hunger all around, and it was hunger.
Listen, I want to thank you both, obviously, for giving us the insight. And again, look, the key thing about both these programs is they're there for everybody, right? So, and both Sarah and I brought up personal stories here, and the numbers here were staggering about the 2 million Pennsylvanians who have SNAP benefits, the over 3 million Medicaid funded. I think I was losing track here. The 33% of birth, 60% of nursing homes, 48% of kids with special needs, and I forget it was in quotes as to what they were referring to. But we're going to see all those numbers again, and we'll go into them a little bit more detail. That's how important these programs are. There's so much need out there, to which we got together as a country and said, look, we're going to make something better. And we're going to be sure to put together a safety net that's going to be there for people, whether it be in a short term or for sometimes people are how God made them to be. And we're going to make a commitment to be sure that we're not going to have people begging for health care, which we still haven't fully solved. And we're not going to have people hungry in a country as blessed as ours. Again, we still have a ways to go. But this was all before federal changes. So as we continue to delve into August here, we're going to be going into each one of these topics to understand a little bit more coming up on Monday. So hopefully you can plan your lunch with us. Monday, August 11th, we'll be going into work reporting requirements. We touched on it today. We're going to go into a bit more on that on August 11th. On August 18th, we will be talking about federal changes for the ACA and Penny. That's on the 18th. That's the Medicaid expansion. On the 20th, we're going to be talking about hospitals and long-term care. On the 25th, SNAP and the Charitable Food Network. So those are what we have planned. I will let you know. Additionally, we'll be having somewhat related discussion about federal changes for education, or some of the concerns that we have to be aware of if federal commitment to education doesn't come through. So those are that's what we have in mind for us, our discussions in August. Again, I want to thank both Aaron and Sarah, Just Harvest, and the Health Law Project for making time to give us a little bit of understanding as to what these programs were. Now we're going to be taking the next step. So be sure to pack your lunch, be with us on those dates, look for the email updates, continue to send us questions. We're going to try and send any questions out to people directly here so they can get back to you and help you out. And again, we're going to learn more together as we go through it. Medicaid and SNAP are there for everybody. And hopefully it's a commitment that both Democrats, Republicans, Independents, and everyone makes together to be sure that that will be there for those times when they're needed. And then hopefully serve as the launching point for greater independence, greater opportunity, greater food security and financial security, middle class and above, for as many, if not everybody, as possible, that we can get across that sort of finish line. that I know every family hopes to get there, right? So we're going to talk about that coming up. We'll see you on Monday. Thanks for joining us. Thank you, Aaron and Sarah, for the time.